Number 3. Argument for universal healthcare. Universal healthcare in the U.S., which may or may not include private market-based options, offers several noteworthy advantages compared to exclusive systems with inequitable access to quality care, including I. Addressing the growing chronic disease crisis. 2. Mitigating the economic costs associated with said crisis. 3. Reducing the vast health disparities that exist between differing SES segments of the population. And 4. Increasing opportunities for preventive health initiatives. 18, 19, 20, 21. Perhaps the most striking advantage of a universal healthcare system in the U.S. is the potential to address the epidemic level of non-communicable chronic diseases such as cardiovascular diseases, type 2 diabetes, and obesity, all of which strain the national economy. 22, 23. The economic strain associated with an unhealthy population is particularly evident among low SES individuals. Having a low SES is associated with many unfavorable health determinants, including decreased access to and quality of health insurance, which impact health outcomes and life expectancies. 24. Thus, the low SES segments of the population are in most need of accessible, quality health insurance, and economic strain results from an unhealthy and uninsured low SES. 25, 26. For example, diabetics with low SES have a greater mortality risk than diabetics with higher SES, and the uninsured diabetic population is responsible for 55% more emergency room visits each year than their insured diabetic counterparts. 27, 28. Like diabetes, hypertension, the leading risk factor for death worldwide. 29, has a much higher prevalence among low SES populations. 30. It is estimated that individuals with uncontrolled hypertension have more than $2,000 greater annual healthcare costs than their normotensive counterparts. 31. Lastly, the incidence of obesity is also much greater among low SES populations. 32. The costs of obesity in the U.S., when limited to lost productivity alone, have been projected to equate to $66 billion annually. 33. Accessible, affordable healthcare may enable earlier intervention to prevent or limit risk associated with non-communicable chronic diseases, improve the overall public health of the U.S., and decrease the economic strain associated with an unhealthy low SES. Preventive initiatives within a universal healthcare model. Beyond providing insurance coverage for a substantial, uninsured, and largely unhealthy segment of society, and thereby reducing disparities and unequal access to care among all segments of the population, there is great potential for universal healthcare models to embrace value-based care. 4, 20, 34. Value-based care can be thought of as appropriate and affordable care, tackling wastes, and integration of services and systems of care, i.e., hospital, primary, public health, including preventive care that considers the long-term health and economy of a nation. 34, 35. In line with this, the ACA has worked in parallel with population-level health programs such as the Healthy People Initiative by targeting modifiable determinants of health including physical activity, obesity, and environmental quality, among others. 36. Given that a universal healthcare plan would force the government to pay for costly care and treatments related to complications resulting from preventable, non-communicable chronic diseases, the government may be more incentivized to offer primary prevention of chronic disease risk prior to the onset of irreversible complications, and 2. Promote widespread preventive efforts across multiple societal domains. It is also worth acknowledging here that the national public health response to the novel coronavirus 19 virus is a salient and striking contemporary example of a situation in which there continues to be a need to expeditiously coordinate multiple levels of policy, care, and prevention. Preventive measures lessen costs associated with an uninsured and/or unhealthy population. 37. For example, investing $10 per person annually in community-based programs aimed at combating physical inactivity, poor nutrition, and smoking in the U.S. could save more than $16 billion annually within 5 years, equating to a return of $5.60 for every dollar spent. 38. Another recent analysis suggests that if 18% more U.S. elementary school children participated in 25 minutes of physical activity 3 times per week, savings attributed to medical costs and productivity would amount to $21.9 billion over their lifetime. 39. Additionally, simple behavioral changes can have major clinical implications. For example, simply brisk walking for 30 minutes per day, greater than or equal to 15 med-hours/week, has been associated with a 50% reduction in type 2 diabetes. 40. While universal healthcare does not necessarily mean that health policies supporting prevention will be enacted, it may be more likely to promote healthy lifestyle behaviors, example, physical activity. 2. Environmental factors, example, safe, green spaces in low and middle-income communities, and 3. Policies, example, banning sweetened beverages in public schools, compared to a non-inclusive system. 34, 35, 36. Nordic nations provide an example of inclusive healthcare, coupled with multi-layered preventive efforts. 41. In this model, all citizens are given the same comprehensive healthcare, while social determinants of health are targeted. This includes mobilizing and coordinating a large number of players in society, which encourages cooperation among players including municipal political bodies, voluntary organizations, and educational institutions. 41. Developmental and infrastructural contributions from multiple segments of society to a healthcare system may also better encourage government accountability compared to a system in which a select group of private insurers and citizens are the only stakeholders. Coordinated efforts on various non-insurance-related fronts have focused on obesity, mental health, and physical activity. 41. Such coordinated efforts within the Nordic model have translated to positive health outcomes. For example, the Healthcare Access and Quality (HAQ) Index provides an overall score of 0 to 100, 0 being the worst, for healthcare access and quality across 195 countries and reflects rates of 32 preventable causes of death. Nordic nations had an average HAQ score of 95.4, with 4 of the 5 nations achieving scores within the top 10 worldwide. 42. Though far more heterogeneous compared to Nordic nations, example, culturally, geographically, racially, etc., the US had a score of 89, 29th overall. 42. To provide further context, other industrialized nations, which are more comparable to the US than Nordic nations, also ranked higher than the US, including Germany, 92, 19th overall, Canada, 94, 14th overall, Switzerland, 96, 7th overall, and the Netherlands, 96, 3rd overall. 42. Number 4. Conclusions. Non-inclusive, inequitable systems limit quality healthcare access to those who can afford it or have employer-sponsored insurance. These policies exacerbate health disparities by failing to prioritize preventive measures at the environmental, policy, and individual level. Low SES segments of the population are particularly vulnerable within a healthcare system that does not prioritize affordable care for all or address important determinants of health. Failing to prioritize comprehensive, affordable health insurance for all members of society and straying further from prevention will harm the health and economy of the U.S. While there are undoubtedly great economic costs associated with universal healthcare in the U.S., we argue that in the long run, these costs will be worthwhile and will eventually be offset by a healthier populace whose health is less economically burdensome. Passing of the Obama-era ACA was a positive step forward as evident by the decline in uninsured U.S. citizens, estimated 7 to 16.4 million, and Medicare's lower rate of spending following the legislation. 43. The U.S. must resist the current political efforts to dislodge the inclusive tenets of the Affordable Care Act. Again, this is not to suggest that universal healthcare will be a cure-all, as social determinants of health must also be addressed. However, addressing these determinants will take time, and universal healthcare for all U.S. citizens is needed now. Only through universal and inclusive healthcare will we be able to pave an economically sustainable path towards true public health.